Okay, great. Hi, good afternoon. My name is Klarque and I work with the Young Women's Resource Center. I'm also a doula. What is a doula, you may ask? A doula is a birth worker. A doula is there for all kinds of support, emotional support, mental support, physical support during your birth. I also want to add that we have two other birth workers with us, Frieda and Olivia, who will give their introduction shortly. We're doing this video for Black Maternal Health Week, which is April 11th through 18th. Woo! We really just want to expand everybody's knowledge, including healthcare providers, birth workers, single mothers, married mothers, anybody who identifies themselves as a mother. We definitely want to reach today. So we're very excited to share our content on reproductive justice, ways we can help, safe environments. So please leave any comments or questions below, and we can go ahead and start with the introductions of the others. Go ahead, Olivia or Frieda.
Okay, I'm Olivia Samples. I work at the Iowa Coalition for Collective Change, which is a statewide anti-violence coalition focusing on marginalized people and homicide and other violent crimes. I'm also a doula. I'm a birth doula, a postpartum doula, and a lactation counselor. So I have my own business supporting families in that. Yeah, that's me.
My name is Frieda Beckwith. I also work at the Young Women's Resource Center. I get to work with a lot of youth between the ages of like 10 to 21, doing like group facilitation and education. I'm also a doula at the Women's Center. I provide support through labor and delivery, and I also provide support to people who are seeking abortions.
Great. Oh, and I forgot to add what I do at Young Women's Resource Center besides doula. I'm also a perinatal specialist, a lactation counselor as well, and we help the young mothers through our doula program, which is free of charge to them. It's for any of our youth from ages 12 to 22. So that is basically what we put a lot of our focus on, and we're really trying to grow our program and help as many mothers as possible.
Okay, so our webinar today is about reproductive justice 101. So what is reproductive justice? The definition of reproductive justice has actually been adapted a little bit over time, but the original definition was the human right to have children, not have children, and parent the children we have in safe and sustainable communities. Later, Sister Song added the right to bodily autonomy in recognition of trans and non-binary people. And I think that's really cool that this organization realized that they missed something and went back and added. And I think adding the right to bodily autonomy actually really creates a full picture of reproductive justice that wouldn't be there without that point. So reproductive justice basically came out, reproductive rights movement came out of the women's movement, which was like a white women's movement for abortion access primarily. And that movement is really focused on legal issues, so Roe v. Wade and the Hyde Amendment, all of those type of things. And it's really focused on individual choice as well, which is where we see like in the abortion debate, like pro-choice and pro-life. But then in 1994, a group of Black women called the Women of African Descent for Reproductive Justice coined the term of reproductive justice. Which I think is really cool because they saw a movement that wasn't seeing them and created their own, which is pretty amazing, I think. They also, in 1996, so 2 years later, they brought it to the United Nations and used the United Nations Human Rights Framework to solidify reproductive justice as a human right. So reproductive justice is a human right according to the United Nations. So it's an internationally agreed upon human right, which is pretty cool. But obviously not recognized in a lot of countries, including ours, which sucks. But it's pretty cool that they even got it up to an international level of it being a human right. So yeah, that's what reproductive justice is, the basic definition.
Okay, so I guess we can move on to our second point with how does reproductive justice go hand in hand with Black Maternal Health Week. I want to definitely touch on mortality, self-efficacy, and autonomy. I want to start by giving some maternal mortality rates for women, African American women specifically. We're 2 to 3 times more likely to die. Also, pregnancy-related deaths at the rate for college-age women and college our counterparts education. And lastly, we're more likely to be mistreated and not heard in birth settings. So therefore, this causes stress. This is going to cause that. This is going to cause high blood pressure and things of that nature. So of course, we all need to advocate for better treatment of ourselves, better treatment of our friends, our own mothers, our grandmothers, whoever it may be. So basically, I wanted to start with autonomy. We can say no to anything that we want to say no to. We can say yes to whatever we want to say yes to. We should never feel bullied or feel like our pain is not heard or that it is not important. So something that I have often seen as a doula is that the pain is belittled, or it's, oh, you'll be okay, you'll get through this. And that doesn't necessarily have to be the case. We can stand up for ourselves and say, no, I'm in pain right now and I would like an epidural, or no, I do not want an epidural because I know that I can handle this. So either way it goes, we should be able to say how we feel and always be heard. And as far as self-efficacy, we can stand up for ourselves and say, no, I know there's a problem here. This is not regular for my body, and I need you to hear me and understand me so that my labor goes well and goes better. The ability to have children and the ability to be able to birth is very important. So for a woman of color, a Black mother especially, they are having the choice. It is their choice to say, I'm going to birth this baby naturally. I'm going to birth this baby medicated. I'm going to do anything that I can. So whether it's a single mother, a mother with a partner, a mother who has a village to help raise her child, she is completely in control of that, and that right can never be taken away. And while we're talking about the rights that can and cannot be taken away, I wanted to touch on a virus that is affecting us all right now. The reason we're even doing a Zoom in the house, COVID-19. It's causing a lot of women to stress. It's causing a lot of Black mothers especially to stress because it's already hard for when we go into birth settings or medical settings. So now we're in a setting where they're really telling us we don't have a choice, where, oh, I can take my baby away, or my baby cannot be seen for me up to 2 weeks because of testing. Recently, I had a friend actually who had a baby, and they took her baby away for 6 hours for testing, and those are vital hours. So now the laws and things are getting ready to change to where it's more of an agreement between the mother and her provider or the nurse to say, hey, this is okay. I'd rather not have my baby be taken away right now, maybe in a few, or I want to do some skin to skin or some golden hour activities such as breastfeeding or skin to skin with father or anything to help with the bonding. So COVID shouldn't be something we're scared of right now. This is still a time where we can stand up for ourselves and not be told we can or cannot do something. So just, I want everybody to keep that in mind from COVID things to seeing your baby and having at least your partner in the room, to getting your blood pressure taken, or saying, no, I do not want that many cervical checks right now. Everything is fine, and it should always be known that you are okay and you are doing the best that you can. So that's something that I definitely want to touch on. And now, Frieda, if you wouldn't mind.
Yeah, so I'm gonna kind of chat about another part of the definition that Olivia gave us of reproductive justice, and that is the right to not have children. I think a lot of the time we kind of like separate like birth justice and birth rights from other issues around bodily autonomy, but that doesn't really serve anyone when we do that, because I mean, people who reproduce and people who birth, they have bodily autonomy needs in other ways as well. I mean, just because a person has one baby or 5 babies doesn't necessarily mean that they want more. So part of having that bodily autonomy is the right to not have children. And so the first part of that is comprehensive sexual health education. And part of what I do at the Women's Center is teach reproductive health to young women in the community. And the state of sex education standards in Iowa is very, very poor. There's like little to no enforcement. There's no self-reporting of schools or school districts, and it's really open to interpretation and bias. So like right from the get-go, when women are young and when people are young, they don't necessarily have access to information. And I think that can take a lot of their bodily autonomy away if they don't even get that information about how their body reproduces and how it works. So one way that you can be an advocate for reproductive justice is supporting sexual health education. The next part of the right to not have children is access to reproductive health care and birth control options. So this looks like making sure that birth control is financially accessible through healthcare coverage, that it's like physically accessible in clinics and healthcare settings. And again, that people have all of the like information and options that they need to like make the choice that's right for them if they're deciding to use birth control. And finally, the right to not have children includes access to abortion. And I think that is a really big one that's often separated when we're talking about reproductive justice and birth justice. But what a lot of people don't think about is that 59% of people who are getting abortions already have at least one child. So people aren't really split into these two categories of like those who birth and those who have abortions. Like really those overlap a lot. So like Olivia was talking about, a lot of the time when people talk about abortion, it's just in kind of a pro-choice framework, right? It's like placed on the individual if they like make a choice to seek an abortion or not. But we know that choice doesn't happen in a vacuum, right? So it's not so much, when we're thinking about it in a reproductive justice lens, it's not so much about a person's individual choice, it's about access, right? So like what are the barriers that might prevent them from making that choice? And like we said, it might just be like information, if they were not given like accurate, comprehensive information about their bodies and the ways that they can have autonomy over them. Stigma is a huge barrier. We know that 1 in 4 women, and it might be higher, have an abortion at some point in their life. So this is a really, really big number, but it's still hard to talk about. And a lot of people feel so much shame around it and around making that choice that it can often like prevent people or cloud their judgment when they're like making that individual choice, right? Especially because they might have misinformation about what the reality of abortion is. Financial barriers are huge when it comes to abortion. So 75% of people who seek abortions live under the poverty line. And this is just another way that reproductive justice is an economic issue, especially because we know in our country and in our state of Iowa who is more likely to live under the poverty line, and that's Black and brown women. State insurance also does not cover abortion. So Medicaid does not cover it. Medicare does not cover it. This can cost anywhere from $700 to $2,000 out of pocket at the time of the procedure. So that is a huge, huge, huge barrier that a lot of people face. The Iowa Abortion Access Fund is a great organization that helps folks financially kind of like decrease that barrier as well as they can. And then there's also physical barriers. So in the state of Iowa, we only have 6 abortion providers. And it's a pretty big state, right? So when you think about that, that means travel, that means lodging, paying for a hotel room, that might mean some time off work, that might mean needing to find and pay for childcare. And those are all barriers that a lot of people don't think about. You know, it's not just as simple as a person's individual choice when they're seeking that. The Midwest Access Coalition is another really awesome organization that works with people to help with some of those financial and physical barriers too in Iowa when they're needing to seek an abortion. So yeah, comprehensive sex education, access to birth control and contraception, and access to abortion are kind of all the ways that it plays out in our state and with our clients when we're talking about the human right to not have children.
Awesome. Thanks, Frieda. That was really informative. You're so knowledgeable. So I'm going to talk about the last couple of parts, which is the right to parent in safe and sustainable communities and the right to bodily autonomy. So I personally based my doula services off of the social determinants of health, which is basically a very academic way to say like the factors that influence how we live, work, and play. So thinking about things like housing access, food access and food deserts, violence, even things like access to green space are things that I like support my clients in, and things that are really important for being in a safe community that supports you holistically. So other things that influence that are part of your right to parent in safe communities include things like being free from violence, which has a lot to do with the economics of your community. So if people have access to jobs and good wages, if they have access to insurance, things like that, access to economic resources is one of the main factors in how much crime there is in a community. So that's really important. Things like policing, like your community being over-policed would make you feel really unsafe, or under-policed would also make you feel quite unsafe. And then the criminal justice system, so thinking about the amount of Black men that are incarcerated at ridiculous rates compared to their white counterparts, that has a huge impact on Black families. And even things, so all of those things really affect your ability to parent the children that you have and to parent them in a way that will help them, that will be supportive for their growth. So that's a really important part of the reproductive justice definition. And then the last part is bodily autonomy. So this was added, as I said earlier, in kind of a recognition of trans and non-binary people that wasn't there at the start. And this really overlaps into a lot of the things that Klarque and Frieda talked about already. But things like abortion, access to abortions, right, is bodily autonomy. You shouldn't be forced to carry a pregnancy. Access to gender-affirming surgeries or hormones, those are really important for people being able to look and feel the way that they want. Thinking about historically sterilization and reproductive coercion of even our legal system telling folks that they have to be sterilized in order to avoid prison. And then as far as rape, so going to your right to not have your body used without your consent is a really big part of bodily autonomy as well. So I think those, being able to parent in safe and sustainable communities can really overlap into a lot of issues. So at the Coalition for Collective Change that I work at, we work on anti-violence issues, and we do work on a lot of these issues that affect communities. So thinking about housing access, thinking about violence and policing, the criminal justice system, even environmental justice, and the ways that pollution or clean water affect our communities are all things that my organization works on in Iowa. And I think that it's really amazing that this framework can be translated into so many other movements and so many other, can be really connected to so many other things. I think it makes it a really holistic and connected movement, which I really appreciate about it. So lastly, Klarque, did you want to say anything else about our Black Maternal Health Week or the Women's Center?
I did. I just wanted to add a little bit more about Young Women's Resource Center and the demographic that we serve. I wanted to just basically say, like, our demographic is a very unique demographic because we serve young moms, and young moms usually have struggles of their own. And something that we do not realize sometimes is that young moms are not only mistreated just because they're young mothers, but if they're young mothers of color, they're mistreated twice as bad because people look at them like, oh, well, you shouldn't have done this anyways. We've literally had mothers come back and report to us about multiple glucose tests. We've also had mothers come back and report to us, doctors literally telling them, well, you need to get your tubes tied because you don't need to have any more children. And that is so hurtful and so ugly. So something that I love that we do at Young Women's Resource Center is that we can advocate for the girls as doulas. We can advocate even as perinatal specialists in the Young Mom, Powerful Moms group. And with Young Women's Resource Center, because the service is free for the girls, it leaves that worry of finance, of how am I going to pay for this? How can I afford this, even though this is a wonderful service? So we're able to give them the advocacy and the love that they need and can actually use to help them grow and understand not only their own birth, but what's going on around them, and that they can see that, oh, I have somebody here for me. I have somebody here in my corner, because we don't know what they're dealing with, that they're dealing with poverty or trying to finish school or just trying to even keep the lights on in their home. At least this is one thing, their birth is something they do not have to worry, do I have to do this on my own? So I really enjoy working at Young Women's Resource Center. I can speak for Frieda, I guess, a little bit and say I think she does too. And the work that we do, I feel, is very unique and special. And for Black Maternal Health Week, I'm glad we're able to even use this platform to bring forth these things that need to be talked about and that kind of get overlooked sometimes. So I'm glad that we're able to do this. That's really all I wanted to add there. So anything else you wanted to add, Frieda? I guess that we can say that this has been our chat about this then, Olivia.
That's it.
Great, thanks. Bye.